time after 4:30, he said. I suggested 5:30 or 6, because if you're gonna come back up for the 6:30 meeting, let's just do it right before that. Sure. Make sense?
Makes sense to me.
Okay. We'll talk to him when he gets here. He's held up, Don.
Yeah, I know.
Here he comes right now.
Oh, there it is.
What's up, Tara?
We'll let him take his coat off.
I've been asked to hold the mic closer to you so people can hear you. I told him I told you that.
Was that Mike saying that?
Or what, no.
Call the Oglesby City Council meeting to order.
Augubright,
Here.
Cullinan,
Here.
Curran,
Here.
Udis,
Here.
Rivara.
Here. Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Before we go on, I'll just move a little bit to different, at about 4:27 this evening, I've got a letter from St. Margaret's Health. This letter is marked confidential, not for distribution, but it's, the media has also gotten the letter. And it basically summarizes in 5 pages, what's been going on. Need one more.
That many.
So Amy has volunteered to read the letter.
Okay. Okay. The letter is dated February 6, 2023. Today, we are again meeting with Senator Rezin and Representative Yednock to present them with this document. This was also sent to our employees, so they heard from SMH first. We wanted you, our local leaders, to be aware of the current state of SMH prior to the media and the public being informed. St. Margaret's Health, SMH, needs an immediate infusion of state support in order to continue operations and our mission of serving our communities. Ongoing trends in hospital finances nationally, statewide, and locally have forced SMH to close the Peru location temporarily while waiting for the Illinois Department of Public Health to promulgate rules to implement the Rural Emergency Hospital designation recently enacted by the Illinois General Assembly, and signed into law by the governor. SMH has completed and sent to the federal government our application to operate as an REH, but SMH may not have the finances to convert SMH Peru to an REH without financial assistance from state or federal monies. We are guided by every decision and action we take by the goal of continuing to provide numerous high-quality services at the Peru Hospital and by transforming the Spring Valley location into a full-service center of excellence serving the people of our communities. This means we are looking for ways to maintain the OB services, which are extremely valuable to our patients and families and are at the core of our mission and values. OB is a very challenging service to provide due to the economics and reimbursement and a host of other factors which have resulted in numerous Illinois hospitals deciding they can no longer provide the service. On January 24th, 2023, SMH completed and filed the REH application with CMS. We are in the process of working with the IDPH and CMS to continue next steps for REH acceptance. Without an immediate infusion of cash, we cannot pursue an REH in SMH Peru. We also need to shore up the financial situation at SMH SV to continue to support operations, including payroll, and begin paying a significant backlog of bills for both facilities. SMH has a reputation for always paying its bills. The amount needed to accomplish both opening the REH and temporarily reopening OB in SMH Peru and continuing operations in Spring Valley is significant. The reason OB would be temporarily at Peru is that it would need to move to Spring Valley if Peru is designated an REH. We are exploring all options, among which is acquisition by a larger health system. We would like to engage state policymakers in a pilot or demonstration program which keeps OB available in our area and in similar areas across the state who have faced this dilemma or will face it in the near future. We believe the silver lining in this dark cloud, which we have all been under in the past few months, is that we can together envision and support and provide a model for how hospitals and communities such as ours in Spring Valley, Peru, and the surrounding area can survive financially. Background: the financial crisis confronting Spring Valley and Peru is not unique to our system or our region. Just a few days ago, the Illinois General Assembly and Governor recognized the crisis in healthcare finance by approving $460 million in emergency relief funds for hospitals statewide. As 2 general acute care hospitals, SMH will receive a combined $1.2 million, approximately, once approved by CMS, expected in April. This is greatly appreciated, but more is needed immediately. In 2018, IVCH was in serious financial distress, and St. Margaret's Health was suffering the effects of lower reimbursement as well. After numerous attempts, IVCH was unsuccessful in attracting other hospital systems to purchase their operations. A recommendation made by one of these systems was for IVCH to reach out to SMH and merge locally. The affiliation process began in late 2018. However, the affiliation was not culminated until January 1 of 2021. Several factors contributed to this delay. As part of our due diligence and to get more favorable financing, SMH required a qualified audit of the IVCH finances. This took considerable time, but ultimately, SMH was able to secure the financing needed and proceeded to file necessary documents to obtain 2 certificates of exemption for change of ownership from the Health Facilities Services and Review Board for the appropriate change of ownership to proceed with the affiliation. Huron Consulting Group was contracted to assist SMH with the affiliation process. SMH had a vision of one consolidated health system which would serve our community better, eliminate wasteful duplication, and allow for an expansion of services. SMH felt the business plan was robust and doable, and SMH was excited to create a regional health system for our community that would be sustainable, albeit marginally profitable. Despite the potential negative financial impacts, SMH chose to pursue affiliation with IVCH. This was an effort to improve health care in the Illinois Valley and in hopes of saving hundreds of jobs and pensions. SMH assumed responsibility for the IVCH underfunded pensions to the tune of several million of SMH reserve funds. This was done to protect past and future IVCH retirees enrolled in IVCH legacy pension plans. In March of 2020, when COVID became a reality, both hospitals were overwhelmed almost to the breaking point. We had to suspend all elective surgeries and experience a drop in outpatient and inpatient revenue. Keeping the hospitals running was crippling our network. Sisters of the Mary of Presentation shared $8 million that other SMP ministries received from federal COVID funds with SMH as allowed by law. Exhausted staff who were able to retire did, and at a time when both hospitals needed more staff, contributing to already short staffing levels. SMH has not been immune to the nationwide epidemic of healthcare workers leaving the workforce. SMH was and is forced to rely on temporary agency staff at 3 times the cost of regular hospital employees. As SMH moved through 21 to 22, the need for agency staff accelerated, thus increasing cost even further. Staff wages were increased but could not match those wages offered by agencies and of larger competing health systems and nursing homes. Retention bonuses and sign-on bonuses were offered to retain and attract new staff with little results. For instance, on the day SMH Peru temporarily suspended inpatient services, there were 300 unfilled job openings across the St. Margaret's Hospital organization. As a result, SMH has been forced to pay contracted labor agencies almost $16 million of unbudgeted monies in the last 12 months. In February of 2021, just a month or so after the affiliation, SMH Spring Valley incurred a crippling cyber attack that nearly brought Spring Valley Hospital to its knees. We were not able to communicate intra-hospital and inter-hospital, access patient records nor patient accounts. We could not bill or collect on bills. The devastation that this single event brought to our organization cannot be emphasized enough. In March of 2022, SMH began to implement its plan to move 1 acute care hospital and 1 outpatient center. Initially, Peru was slated to be the acute care and Spring Valley an outpatient center. The county line issue had prevented this from happening. Senator Rezin and State Representative Lance Yednock were instrumental in overcoming this barrier. We're very grateful for our legislator supports and efforts in changing legislation to allow SMH to proceed with this plan. Simultaneously, we were preparing the documentation to submit for a CON to discontinue Spring Valley as an inpatient acute care hospital. As part of that process, we sent a letter outlining our financial condition to local elected officials, including legislators. Here's a portion of what that letter, which is dated July 22nd, 2022. In quotes, it says, maintaining two inpatient hospitals, which are approximately 4.5 miles apart, is not economically sustainable or feasible. The average census at Spring Valley has declined from 2.14 in 2018 to 18.9 in 2020. Similarly, the occupancy rate at Spring Valley has declined from 48.7% in 2018 to 43.1% in 2020. For that same time period, the average census at Peru has declined from 23.1 to 19.5, and for the period of 2019 to 2020, the occupancy rate has declined from 46.5 to 39.8%. In addition, the facilities include the hospitals and physicians' clinics have lost and generally will continue to lose significant amount of money on operations. Operating losses were over $18 million for Spring Valley for fiscal years 2018 through 2021, and over $27 million for Peru for fiscal years 2018 through 2021. Excluding government-supported funds from the Provider Relief Act and American Rescue Plan Act of $14.5 million for Spring Valley and $12.5 million for Peru, the operating losses would have totaled over $32.5 million for Spring Valley for fiscal years 2018 through 2021 and over $39.5 million for Peru for fiscal years 2018 through 2021. Further, the operating losses have continued into fiscal year 2022. For the 8 months ending May 31st of 2022, Spring Valley and Peru have a consolidated operating loss of over $9.5 million. Excluding additional government support funds from the Provider Relief Act and the American Rescue Plan Act received in February of 22 of $8.1 million, the operating loss would have totaled over $17.6 million. Spring Valley and Peru do not anticipate any future government support funds. That is the end of the quote. While we were starting our plans to make Peru the inpatient hospital, conditions changed in Peru. In looking at the physical plan, it became apparent that a significant capital investment was required. As a result of the drain on hospital finances from the cyber attack, COVID, and increasing staffing costs, St. Margaret's Health no longer had the capital resources to update essential areas of the Peru campus. In addition, Peru had difficulty in attracting and retaining hospitalists to provide medical care. Only one hospitalist every other week, and he was leaving in October of 2022. Therefore, due to insufficient physical hospitalist coverage, a deteriorating financial condition, and increasing difficulty in adequate nursing, respiratory, and other clinical staffing, St. Margaret's Health consolidated most inpatient cares to Spring Valley, with the exception of OB and ICU. Spring Valley has been able to accommodate the need for inpatient care since then, with no need for additional capital improvements. In September of 2022, SMH became aware of the Consolidated Appropriations Act of 2021, creating a new category of hospital, REH, or Rural Emergency Hospital. SMH immediately began to explore this as an option. The REH would be eligible to receive 105% Medicare reimbursement on the normal fee structure for services billed for outpatient care and, more significantly, approximately $3 million annual facility fee. SMH was also reducing services, especially in areas where it was bleeding money. OB was moved from Spring Valley to Peru to reduce significant losses by consolidating to one unit and reducing agency staff. Even with those efforts, we continue to lose a great deal of money. There was great concern about not offering this program, which SMH has subsidized because it is so important to the community. 70% of reimbursement for OB is Medicaid. For every dollar of delivery, SMH receives 10 cents, resulting in a $3.5 million loss annually. The decision was made to pursue discontinuation of OB and join the ranks of other local hospitals who had already made this difficult choice. It is SMH's wish to support OB services in the Illinois Valley if adequate funding is made available from state or federal government sources. As finances deteriorated, SMH increasingly put its hopes on REH status. Hope was that legislation would recognize REH as a new type of hospital in Illinois. Senator Rezin and Representative Yednock were key players in getting legislation passed quickly in both chambers to be signed into law by Governor Pritzker. Representative Yednock also reached out to the governor's office to urge that this issue be a priority. The second hope was that IDPH would be ready with the necessary rulemaking, as some states were, so Peru could immediately begin the application process to garner REH status. SMH does not see REH as an end-all solution. Efficiencies must be realized, services reviewed, and duplications eliminated. OB was just one of the many hard decisions that must be made to ensure the future of SMH. As SMH reserves dwindled, in order to support services to the community, our accounts payables continued to increase. In December of 2022, SMH was notified by our Peru ER physician provider that they had not received payment for August, September, and October, a total of $698,000. SMH paid these balances by December of 2022 as agreed to. However, on January 13th of 2023, SMH received a letter terminating ER physician services in just 15 days. This action prompted urgent efforts to find alternate coverage for ER at Peru to no avail. On January 19th of 2023, an emergency board meeting was called to update the board of directors. Tim and Terry then met with medical staff from both facilities at noon the following day, Friday, to inform them of the need to temporarily suspend all inpatient services at Peru on January 28, 2023 at 7 a.m. Even though the request was made of those in attendance to keep this confidential until others could be notified, being employees, legislators, and media, the word was out on social media before the meeting ended. SMH immediately began preparing a document informing employees and the public of imminent suspension of services at Peru. Simultaneously, the message was shared with the media. We realize our error now in reaching out to our legislators sooner to inform them of this crisis. Signed, Tim Muntz, President and CEO, Terry Judd, Chairperson, Board of Directors.
Thank you, Amy. And the reason we went ahead and read the letter is that it was released to the news media, and I'm not going to keep it from our residents. Next on the agenda is public comments on agenda items only. Having none, we'll move on. Approve minutes from the January 16th, 2023 regular meeting. Need a motion and second.
I'll make a motion to approve the minutes from the January 16th, 2023 regular meeting. Second.
Augubright.
Aye.
Cullinan.
Aye.
Curran.
Aye.
Udis.
Aye.
Rivara.
Aye. Approve bills in the amount of $351,606.61 as presented for payment.
I will make a motion to approve bills as presented for payment.
Second.
Augubright.
Aye.
Cullinan.
Aye.
Curran.
Aye.
Udis.
Aye.
Rivara. Rivara.
Aye.
Thank you.
Sorry.
That's okay.
Approve Chief Margus to the Illinois Valley Dispatch Board and 911 Board.
I'll make a motion, we put Chief Margus on the IVRD board and 911 board.
Second.
Augubright.
Aye.
Cullinan.
Abstain.
Curran.
Aye.
Udis.
Aye.
Rivara.
Aye. Place on file the purchase of fire station exhaust system.
All right, so we've been talking about this for a little while. As you know, we have that fire station staffed 24/7, 365 with an ambulance crew. And we don't have a station exhaust extraction system, which puts them at significant risk for health problems down the road. So one quote for the system, they're both very similar, very little difference. One came in at $131.50 And the other one came in just over 100,000, I gotta find it here. 101,630 was others, so I would like to place on file the Hastings bid with the Plymouth vehicle exhaust extraction system. Anybody have any questions about this?
What was the cost of that one again?
That one was 101, what is it, Amy? 630. 101,630, and the other one is 130,150.
I have no issues with it. I mean, we asked our firefighters to put themselves in harm's way all the time. I mean, we shouldn't be asking them to put themselves in harm's way when they're doing their job at the station for us.
Yeah, just to be clear, it's the ambulance crew that actually stays there, but they're housed in the fire station, so it's still the same issue.
Yep.
No other questions, I'll make a motion, we place on file the Hastings Air Energy Control bid on the Plymouth vehicle exhaust extraction system in the amount of 101,630.
Second.
Augubright.
Aye.
Cullinan.
Aye.
Curran.
Aye.
Udis.
Aye.
Rivera.
Aye. Approve interconnection application from C. Lemrise.
Yeah, I took a look at the application. It's another solar application. It's only 4.8 kilowatts essentially, so it's a small one. But he's got all the paperwork in there and contractor's licensed, everything, so. Unless anybody's got any questions on it, I'd like to make a motion to approve it. Make a motion to approve the interconnection connection application for C. Lemrise.
Second.
Augubright.
Aye.
Cullinan. Curran.
Aye.
Udis.
Aye.
Rivera.
Aye. Approve raffle license application for Stavrock Runners LTD.
I will make a motion to approve the raffle license application for Starbucks Runners.
Second.
Augubright.
Aye.
Cullinan.
Aye.
Curran.
Aye.
Udis.
Aye.
Rivera.
Aye. Approve renaming both the girls' softball fields, name to be revealed at a later date.
So we're gonna name a field and we don't know the name?
I think we.
They know the name.
Top secret?
No,
Am I not allowed to know, or?
No.
I'm sorry, like, I think we should
Oh,
vote on it when we know the name. Personally, when I saw this yesterday, I was like, wow.
The name of the small field that John Hancock and his crew built would be John Hancock
Okay.
Field.
Okay with
And
that.
the name of the big field that the gentleman who supported it for years and years and years and made a lot of it possible was Hank Moore.
Okay, I'm okay with, as long as we know the name before we approve the name.
I think they wanted to reveal it like at the Mayor's Day Parade,
Oh, I'm
like for the opening.
sorry, I guess
I think that was the only reason why.
I had no idea.
Yeah, I
who
think
the
they
name
wanted
was,
to-
so I had
problem with
ask.
this is
Both-
it's- the problem
both
with this,
people
it's
have been
being streamed
notified.
live though, that's the problem.
I
Yeah,
was just,
both have been
Yeah, no, I'm
talked to and are aware of it.
Totally okay with it now
That'll
that I
be
know the name.
formally taken care of with the,
It'll get formal
at the
unveiling then.
start
my
of the
understanding, right?
baseball
Kelly?
field.
That's my understanding from JP.
Yeah.
Okay,
okay,
that's what I thought.
works.
Okay, I need a
So I will
motion.
make a motion to rename the two softball fields.
Second.
Augubright.
Aye.
Cullinan.
Aye.
Curran.
Aye.
Udis.
Aye.
Rivera.
Aye. Approve the naming of the new disc golf course for Mr. Wes Black.
Yeah, I think that's a great idea, Mayor. He put a lot of work in down there, and I don't know how many hours he put in, but I think it was over 100.
And this is like his third or fourth course
Fifth
he's
one, I think it's
made.
his fifth.
Oh, fifth?
And he did say this is by far the best one that he's ever done.
I think
And
that's
he's
it.
been to a lot of them, so it's gotta be pretty outstanding.
My only question is, are we naming it Black, West Black, or Mr. West Black? Is there, we're gonna figure that out later, I guess?
And I
We'll
think,
figure it out.
A sign
Okay.
has not been ordered.
A
for
sign
that
has
one
not
yet,
been
so
ordered.
that-
Okay.
It will have his name
and just to be
incorporated.
clear, this is not done yet either. He still has
Oh, yeah.
existing work to do before it's operational.
Well, we can't complete the work until it dries out.
Yeah.
And we're able to get some equipment in there. From what I understand, there's a couple widowmakers, limbs on trees that have to be removed, one or two trees down. Other than that, the cleanup, they've done a heck of a job.
With that, I'll make a motion, we name the new Lehigh Disc Golf Course after Mr. West Black.
Second.
Augubright.
Aye.
Cullinan.
Aye.
Curran.
Aye.
Udis.
Aye.
Rivara.
Aye. Place on file, bid submitted for the transformer at the Malik substation.
So this is the one that we went out for the bids. If you remember, one of the things I said is the engineers estimated that it was gonna be between 600 and 800,000, and the problem was it was gonna be a 24 to 28 month lead time. What you probably don't see is here, what came back is the bid evaluation. The problem is apparently none of them got shipped to us in time. And the one from Virginia Transformer, for whatever reason, FedEx showed that it wasn't here, so he drove up and got it here the day before.
The day of.
The day of, right before the opening, actually. And it's the only one that arrived on time. So it's the only one that we can legally even adopt. However, the other ones did come in a day late. We can't use them, but they're for comparables. So, there is one that is cheaper, however, it didn't meet specs. It's a rebuild. And the rebuild is gonna have less warranty time, and it's gonna end up costing twice as much in losses because of the rebuild. So I'm not recommending that one. The other two, by GE, Prolec, and WEG, are close in price, but the difference is they're about 126 and 102 weeks out, which is close to that range that they estimated. The one from Virginia Transformer, the one that is eligible for us to place on file, is only a 60-week lead time. So that's about half the amount of time that we expected.
How reliable are these lead times? Because in the turf industry, Toro said they're gonna have their stuff 3 years ago and it's still
Yeah.
not here. So that's why I'm asking, is there any repercussions if it takes them 120 weeks instead of 60?
That is a good, you know what, that is a great
And
question.
I think we should rebid it anyway if there was only one bid
Well,
and do it proper.
Well, there
Because if
are-
we're waiting 120 weeks, what's two more? That's how I'm looking at it too.
well, it's more than 2 weeks, because then they gotta re-put the bid process all back out. But I mean, if that's the route we wanna go, we could do that to force them to get them in time if you want. But what I'm saying is, the recommendation letter that we got from BHMG is to go with that one anyways, because it is only a 60-week lead time. That is a great question. If you wanna place it on file, then I can find out what kind of because that is a great question. If that was part of the bid thing that you're being evaluated, what is preventing somebody saying, I'll get it to you in a month? And it's just to get
I
it
just think there's probably no ramifications for it, so,
It wouldn't be a penalty, I don't believe. You wouldn't
yeah.
have to.
I can find that out, because you're right, what if that's just a not real statistic that we're given? Because that was one of the concerns I had, when they're telling you 24, 28 months, we've already been waiting 2 years to try to get this whole process going, we finally get it approved, and then now we got a 2-year wait time just to get equipment in.
If we could get it in 60 weeks, that would put us in the process of a little over a year energizing that substation and with the second feed. And that improves our reliability, that does a lot, but we have no guarantee that we're gonna get it in 60 weeks.
It is in the range, it's $796,523. It's at the high end of the range, but it is in the range.
I would have loved to see the other ones, to tell you the truth. Are they in here?
Actually, you have them, Tom.
I have them there, they're not in the one you
just
have.
can't use them, but
You
Oh,
can't-
yeah.
you can use them for
They can't be
comparison.
used.
Yeah, I just want,
Yep.
they're throwing out large numbers, I wanna be able to see it in front of me.
Yeah,
I have the actual.
Okay.
Finally came in.
they came in, yeah. Well, BHMG got them as well, that's where they put it on that comparative. So that one on the bottom, that's the cheaper at 629,000, that's the rebuild.
I'm seeing that now.
And you can see it costs twice as much over time to use it because of the losses. So we would save about 40,000 going with one of the other ones if it was a legitimate one, but again, it's 126
But
week,
the lead time is,
126 week lead time. But Tommy makes a good point, how realistic is that?
So this total price is the 20-year estimated loss, isn't it, too?
Yes.
Yeah, it throws with
Okay.
the loss over time.
Yeah, I still think we probably should rebid it, just because it's just one bid that came in, and he drove it here. The mail must have got lost that day for everybody, or?
All of them, that's what's weird, every single one, every single one of them came
A
late.
lot of them came from the south, and there was a lot of inclement weather.
It's crazy.
Because they all came from the south. We opened bids last Tuesday, and they didn't The one guy drove in here the next day, on Tuesday morning. The other ones came Thursday and Friday of last week, finally. And they were marked, next day delivery for Tuesday.
Oh, they were next day air, and it still was that?
They were-
Wow.
On Monday, they were marked next day air, and we didn't get them until
That's
Thursday or
amazing.
Friday for some of them.
If we would have gotten no other bids for even comparison, I'd probably be a little more likely, to, like what you said, reject them all and put them back out for bid again, but we do at least have comparisons. And the fact that it's at 60 weeks, I'd hate to delay even further in that process.
If we ask them to rebid it, aren't they gonna come back in with the exact same numbers most likely?
I don't know how that whole process goes, because I mean, they're not held to it. I mean, prices could go up in the next month too, the supply chain could be different, I don't know, but you would think they'd come back similar.
I mean, very,
Give
you
the
would-
opportunity to at least have all four bids to choose from then?
You would if you rebid it, but,
If you rebid it, you're gonna
I
put
share
you out
Jason's
6
concerns
weeks.
about that whole process.
Because even if if all of these came in at the exact same time and we legally could pick from any of them, this would still be the one, this is what our engineer, you saw the engineering letter, I think that's what's in the packet, right? That they recommended. Do we not have that one here? Oh, that letter's not in here. Yeah, our engineers recommended that, that's the one we go with because of the lead time.
I'm still. Let's just make sure that lead time's solid. Either
Well,
way.
the good
for
news is
sure.
we only can place it on file tonight anyways.
Yeah.
So we can always cancel it and reject if that's what you wanna do, but I'd rather place it on
We'll
file.
Place on file and get a confirmation on the lead time.
Let's find out. I'll get some more answers on you about that, how accurate that is, if there's any repercussions, but I got a feeling the answer is probably
No.
none.
Probably not.
But I will find out how accurate that is, how reputable the company is on that time frame. If that's your biggest concern. Any other questions on that? In that case, I will make a motion to place on file the transformer bid from Virginia Transformer in the amount of $796,523.
second,
Augubright,
Aye.
Cullinan, Curran,
Aye.
Udis.
Aye.
Rivera.
Aye. Old business. Of the AR accommodation request, from what I understand, that's been addressed?
yeah, it's all taken care of. Mike and his staff cleaned out the boiler room, and they have a couple, what do you have, 2 kennels in there or just one? Just one right
I
now.
was thinking IVRT.
But it's, I think Chris, I think Chris dropped off some supplies.
I'm sorry.
Okay, yeah, she seems to be happy, so
Okay.
we're in a good place.
Public comments? Commissioner reports. Mr. Augubright.
I have nothing to report tonight.
I've got a couple things, Mayor. First, I'd like to thank John Sales and Service. They donated a heating and cooling unit for our police evidence room that has been recently redone. The cost of that unit retail is around $8,000, so it's a sizable donation. So thank you very much, John Sales and Service. Second thing I have is we have conditionally hired 2 police officers to bring our staff to par, where it should be, both of them off of our lateral hiring list. The first one is a 6.5-year veteran of Mendota Police Department. His name is Paul Peterson, and he's gonna be starting mid-February for us. The second one is Scott, is it Nuftel? Nuftel. He comes to us from Spring Valley Police Department, where he's a 4-year veteran. And he's gonna start more towards the end of the month, but I think like the 22nd or something like that. We're gonna try to have them both sworn in, do the badge pinning at the next council meeting. But Amy will be swearing them in before then, so that, like, Paul can start shift and get us back where we need to be. That's all I have, Mayor.
Tully?
Yeah, a couple things here. Applications for summer help are now available online or visiting the City of Oglesby website or going to City Hall and requesting an application. Positions available are park and recreation staff, certified lifeguards, and pool staff. The 2023 boys baseball season is available to sign up for visiting oglesbybaseball.com or the Oglesby Boys Facebook page. Registration closes March 9th, and no late signups will be accepted. 2023 girls softball season is also available to sign up. Please visit the Oglesby Girls Softball Facebook page to sign up. Registration closes February 28th, and no late signups will be accepted. Last but not least, I've given you guys a couple pages here of what we talked about earlier, and I know it was brought to my attention about this dog park, and I've looked into it, and I've gotten a couple estimates, and the one estimate is a local business, and they seem to have the best prices on everything compared to what I got from the city, from Jim Clinard. Pretty much matches that, except the only thing that is not on here is the lighting, but as far as lighting goes, I don't believe that we need lighting in a place that should be closed at dusk. There's no reason for people to be down there at night and having lights on. Nobody usually walks their dog late at night like that anyhow. But I've given you guys some estimates, and they fall well within the cost. And I'd like to get this started as soon as possible, hopefully before the next election. At least get something in writing and get it going from there.
On your last page, it says see attached drawing. I didn't see that there.
See what?
It says see attached drawing.
Well, that was the original plan, that was
Where's this gonna be at?
this is gonna be down on the 100 block of West Third Street by the water tower.
I thought that's where the solar field's going in. I thought that's what we talked about.
I heard they're not going there, and I mean, if they gotta go somewhere, you can put them in Lehigh Park next to your volleyball court.
Well, we'll put that on the record if that's where you wanna put it.
That's all I have.
I got a few things.
Mayor? Mayor,
First of all, I forgot Jason.
it's okay.
And I knew you'd have something in.
You got 15 minutes now.
Thanks.
5.
I got one item for our departments. Hydrant grants. Looks like finally things are starting to move on that, finally. We're getting everything ready for going out for a bid package. Everything's kind of approved, except we need one letter to come from the state yet. It was estimated that we were supposed to get it at the end of January. It hasn't come in yet. So I'm hoping it's gonna be very soon, and that we can get out for bids and then get the rest of those hydrants repaired, finally. The only other thing I did wanna touch on, a little bit with the mayor, had read from the thing. I was able to go to the meeting at 10 o'clock prior to the public, the PR stuff that all happened. I got a chance to listen in with Lance Yednock and Sue Resin, talking to the different workers and nurses and stuff. And while I don't have anything additional to add to whatever was in the letter, I do want to tell you that I was very impressed at how well Yednock and Resin work together with stuff. You got one that's a Republican, one that's a Democrat, but they seem to work flawlessly when they're asking all the questions, getting all the details, painting a really good picture and understanding what's going on. I don't know how this is all going to shake out, but I just want to let the public know that they should be very confident in their abilities to work together and get to the bottom of things and leave no stone unturned to see what kind of options they can come up with. That's all I got.
I've got a couple things here. Governor Pritzker has extended the gubernatorial disaster proclamation through Saturday, March 1st. With the signing of the new disaster proclamation, public meetings can be held remotely. The good news is after 30 years, Ameren, effective February 1st, 2023, is going to start collecting and forward to the city of Oglesby the utility tax for the electricity that IVCC uses in the corporate limits of Oglesby, and that is the ICC campus. They have been collecting the utility tax on gas and forwarding that to the city for 30 years. We have been at this for over a year. Now the only question to be resolved is how far back are we going to be able to go back and collect? I've always tried to stay away from picking a fight with people who control the ink. In a recent article by the News Tribune, they listed events, festivals to attend in the coming year. LaSalle, Mendota, Utica, Ottawa, Streeter were among communities that noted in the article. I called the Tribune at least 8 times and left a message requesting a return call. My question was, why was Oglesby Fun Days omitted? I never received a call from the News Tribune. Oglesby can do the same as other communities and never gets noted by the News Tribune. I am not the only mayor who is frustrated by the selected coverage. Tom Collins is more than fair in coverage of the Oglesby City Councils. Oglesby Fun Days are June 15th, 16th, 17th, and 18th of June, Father's Day weekend. We will post a calendar of city events. The city of Oglesby met with Representative Resin in securing help for signage on I-39 for Oglesby businesses. The city clerk has been working with signage, and she has, since our meeting, has also got a contact with the state, so we're moving on that issue. We also have asked assistance in securing charging stations for the city. Don't know what the state is trying to do, but we've just been having a hell of a time with it. We have met with Julie Martino on paintings on Walnut Street. We will meet with Boosty requesting a donation of property behind the Dickinson House. That includes part of the baseball field. IMUA scholarships competition deadline is March 10th, 2023. It's a $1,000 scholarship open to high school seniors. Info may be obtained from the clerk's office. I had this prepared before I got the letter which Amy graciously read. St. Margaret's Hospital has been a symbol of quality health care for the Illinois Valley for decades. A health facility that you could count on to provide the Illinois Valley with medical service in your time of need. I recently had to go to the ER for a medical issue and seek treatment. I cannot say enough about the quality of service that was provided. The clerical medical staff were courteous, professional, and helpful in getting me through my medical crisis. I have used St. Margaret's in Peru and received the same quality and professional treatment from staff. Unfortunately, I cannot say the same thing about the administration of St. Margaret's, who are steering the ship. There is no communications with the Illinois Valley, its employees, or anyone. A public relations and communications would have avoided much of what has occurred. Until the administration of St. Margaret stands ready to communicate and work with its employees, the Illinois Valley, it appears that we won't be able to identify the issues and work toward resolving them. Only then can we return to quality health care in the Illinois Valley. I stand ready to work with them. And moving on, we'll go to closed session. I need a motion and second to go into closed session.
I'll make a motion to go into closed session 5 ILCS 120/2 C2, collective negotiating matters between the public body and its employees or their representatives, or deliberations concerning salary schedules for one or more classes of employees.
Second.
Augubright.
Aye.
Cullinan.
Aye.
Curran.
Aye.
Udis.
Aye.
Rivara.
Aye.
Make sure I heard you correctly, 100 block was third by the water tower. What's the timeline for establishing it?
I don't know, I like to at least, being it falls under a certain amount of money that doesn't have to be approved, I'd like to get it started.
What is that threshold?
What's that?
What is that threshold, the financial threshold that this require?
Well, it's a certain amount of money that you can spend before you have to take it out for a vote. And it's a city,
Do you know the amount?
well, it's under $20,000.
20,000? So you do not foresee coming to the council for a vote?
It doesn't have to if it's under a certain amount of money. If it's under 20,000, it doesn't have to be approved by the council.
What timeline?
Well, like I said, I like to get this thing, I like to get it started before the next election. I mean, so I can get something started. I mean, everything's always put off here and nothing ever gets done if you don't go ahead and jump on it.
People are gonna scream.
Can I get a copy of that statement that you read about the administration on foot verbatim?
the, my state. Ask me for it. Give it to you. I don't know. I'd like to be able to go back 30 years.
Things you learn.
But I'm a realist.
Things you learn.
I have no idea. And what really kind of helps,
Now it's kind of rare, it's like, it's gotta be the enemy.
But people from the same area need to get something done for their district quickly.
Yeah, I've never seen, well, even in the closed meetings that there is, I've never seen them squabbling about the ordinances. It's good, it's always been just focused on what the constituents need, so it's good.
I wanna go to bed.
I got you. Let's get down there.
We'll see you on Wednesday, huh?
I think I'm on the zoning board of appeals.
I need a motion and second to go back into regular session.
I'll make
a motion.
Second.
Augubright.
Aye.
Cullinan.
Aye.
Curran.
Aye.
Udis.
Aye.
Rivera.
Aye. I need a motion to adjourn.
I'll make a motion to adjourn.
Second.
Augubright.
Aye.
Cullinan.
Aye.
Curran.
Aye.
Udis.
Aye.
Rivera. Rivera.
Aye.